Looks like most people have made it in, so I'll get started with some preliminary. Welcome, everyone, to supporting patients using Dexcom. We're really excited about this one. It's our first time sharing what we know about Dexcom and teaching you all about it. So welcome. There's a lot of interest. We had very high registration for this one, and we expect to have a lot of great questions. So throughout the presentation, please use the Q&A, put the questions into the chat. Not the chat, but the Q&A. Now, Whole Health is an independent pharmacy banner, and we have locations from Newfoundland to British Columbia, and our strongest presence is here in Ontario, where we're situated. I do invite some of you in the registration. I see lots of pharmacy owners from other groups. So if you're interested in ownership, please reach out to Molly or myself, and we'll connect you with our business development group, because you can switch banners. So we'd be happy to have you at Whole Health, and you'd see a little bit more of the interesting things that we do that are not externally facing.
We'd
But
love to
back
do
to the
we
sorry.
love to do these sessions for our banner. There's purely internal ones and also ones for everyone here as well. And just as a quick note that we are recording the session. So if you stay on, you are providing consent for the recording.
Yeah, and we won't be inviting you onto the screen, but we'll have your questions read aloud. So this is also a live stream on Facebook. So if you're wondering where to find it afterwards, you can find it on Whole Health's Facebook. You saw there on the last slide, there was Dr. Molly Yang, who's our wonderful presenter and my main colleague at Whole Health for a lot of our programs and operational projects. I myself, James, am also a pharmacist, and we're joined tonight by Jessica Chonglo, who's a co-op student from the University of Waterloo, who helped in the development of this presentation, and she'll be helping moderate with the questions as well. And you may have guessed that this is supported by Dexcom. So thank you, Dexcom, for being a great friend to Whole Health and supporting us on educating pharmacists across Canada on this new technology. Molly, I will turn it over to you.
Thanks so much, James. Thanks everyone for joining us this evening. We have quite a full agenda going over the Dexcom G7 system, which I'm sure many of you are excited to learn more about. We're going to start with some background on continuous glucose monitoring and who it's used for, then an introduction on the G7, including some new features. Then we'll go over some of the apps and setup for patients, and then using the readings from those applications to make recommendations. We'll also cover some other important information for pharmacies, including coverage and other considerations. And we've also built some other infographics on G7 that we'll send out after the presentation. So if you'd like these sent out to you, please also complete the survey at the end of the presentation. Okay, so let's get into it. Now we know that in pharmacy that patients use all types of devices, whether it's continuous glucose monitoring with the sensors that are available now or with blood glucose meters as well. When focusing on continuous glucose monitoring systems like Dexcom, the evidence through Diabetes Canada and guidelines focus on for type 1 diabetes, patients who are on multiple daily injections or pump therapy, and for patients who have type 2 diabetes, using them for patients who are using basal bolus insulin or are not reaching their A1C target. That being said, even though these are the highlighted populations within the guidelines, all patients with diabetes can use CGM systems and would really benefit from the insights and trends that they get from these readings, regardless of their level of diabetes management. These systems really help the patient better self-manage and understand their diabetes control. So what is Dexcom CGM? It's a real-time continuous glucose monitoring system that measures glucose 24/7 and sends readings to the receiver if the patient is using a receiver and or a smartphone, which is most of the time. It sends these readings every 5 minutes and it does not need to be scanned. So it automatically sends them using Bluetooth. Now, not only does it show the current value of what the patient's blood glucose is, but it also shows trends and predicts where that glucose will be. So it really helps patients make more informed decisions with their treatment and with their lifestyle. In terms of indications for use, there are broad indications. For G7, it's anyone aged 2 years and older with diabetes, and it could be any type of diabetes, type 1, type 2, and gestational, and it can be used in home settings or in healthcare facilities. So let's talk about some of the benefits. With CGM, with Dexcom, there is evidence that using that real-time CGM can lower A1C values by 1.1% for type 1 diabetes and 1.4% for type 2 diabetes. In a randomized control trial as well, people with type 1 diabetes who had high risk of hypoglycemia were switched from blood glucose meter to Dexcom, and they experienced a 72% reduction in hypoglycemic events. And of course, the last point here is increasing in time in range. Time in range is a concept that's gaining more and more popularity over these years. It's a measure of the amount of time, either amount or percent of time, that a patient spends in their target range. Now, we know for most patients that average time in range is between 4 to 10 millimoles per liter. And we want patients to at least be 70% of the time within that target range. And time in range really gives us more context to how the patient's blood glucose control is overall compared to A1C, because we know that A1C is just an average value over 3 months, where patients might have an A1C but have very high highs and low lows, but you wouldn't know from that one single number, whereas time in range provides more context as to how much time is spent within that target range. And all of these things, the predicted A1C, the hypoglycemia, and the time in range can be measured on the G7 app.
Molly, as you're switching slides, just a reminder, folks, to please use the Q&A for questions. Molly's got a lot to cover and she's going very fast. So if there's anything you need us to go back to, we'd be happy to do that. Molly, with these new settings, I can't see the chat. So if folks use that, I won't see it.
Okay.
But folks, please use the Q&A and we'll be
Okay.
sure to get to those questions.
Okay, sounds good. I have my eye on the chat and it doesn't look like any messages have come in so far, but I'll let you know. Okay, so let's get into the features. Now, both the older G6 and with the G7 as well, same thing, you don't need to do routine finger sticks or scanning. It's automatic, as mentioned before. You get real-time readings sent to a display device, so either the smartphone or the readers. There's also customizable alarms with predictive alarms for hypoglycemia, which we'll go into a little bit later. And the readings can also be shared with family and caregivers. So one of the biggest changes, and we have the G7 system on the screen here. One of the biggest changes compared to the G6 is really the simplicity of the G7. It was updated to be all in one now. It comes in one package. The package in my hand, it's very small. There's no assembly required, and application is very simple. When the patient picks up the G7 and is ready to apply, they can scan the QR code on the box here, and it will go over a step-by-step instruction for the patient, and it's very clear. When they open up the system, it's just the applicator. It's spring-loaded. They would just need to disinfect the area that they want to apply it in, open it up, and the spring-loaded device is in here. And all they need to do is press down on their arm or whichever other area they want to apply on and press the button. So very, very simple. Of course, similar to other sensors, it measures the interstitial glucose levels through a small wire inserted underneath the skin. It also, I forgot to mention, in the box comes with an over patch. So for patients who have issues with the sensor staying on, it does come with that extra over patch bandage that they can stick on over the patch to help with adhesion.
Yeah, Molly and I, we both tried the 6 and the 7. So if anyone has questions about either of them, we're both quite familiar. And Molly said it's a wire, but I would say it's more like a filament. Like you don't notice that it's there once it's inserted. Of course, you feel that original needle prick as it lances into your interstitial, but once it's there, you don't even feel it. And I was really quite comfortable.
Yeah, and even like application, you do feel because it's that spring loaded, but honestly, for the majority of patients, it is quite painless, right? Because of how small and quick it is.
Yeah.
Um,
There's a question here it's is this safe for a patient with a cardiac issue, a diabetes patient?
that is a great question. Let me get back to that question because I remember we took a look at it. But maybe if Jess can take a quick search or if anybody can comment on the answer to that, but we'll get back to that. Okay, in terms of length of wear, it is 10 days. So that's similar to G6, but they have also added a 12-hour grace period. So after, in the past, it would just end off at 10 days. Now there's that extra 12-hour time where the patient has a little bit of wiggle room, especially, let's say if it's a child, a student, right? And they can't get to the new, the sensor replacement, there's that grace period. And we also mentioned before, patients can use either a receiver or a smart device to read the readings. And if you have any questions about compatibility, there's a link here that patients can access. Okay, on these next two slides, we'll go over some of the differences between G6 and 7, which might be helpful when talking to patients currently on the G6 transitioning over to the G7. So one of the biggest things is visuals. The G7 sensor is very small. It's the smallest sensor available. It also only requires a 30-minute warm-up now compared to the 2-hour warm-up of G6. So making it a lot faster and more convenient for patients. And as mentioned before, it has that 12-hour grace period that allows patients a little bit more flexibility to change their sensor. Some other updates include alarm customization with silent mode and a new delay first alarm setting, which we'll discuss very soon. G7 also has the highest accuracy available in sensors. It's measured in MARD, M-A-R-D, which measures the average difference between the sensor reading and the true value. And so you want the lowest number here. And for G7, it's an 8.2%. Also, the system has been really simplified, as mentioned before. In the past with G6, you had the sensor plus a transmitter that a patient had to buy separately. Now it's all inclusive. So all they need to do is get the one box. G7, everything's included in there. No other transmitter needed. Now, there are some patients where they might have to stick with the G6 system because it's compatible with certain pumps. So if they use Tandem, then that's G6 is the only one that's compatible at the moment. Otherwise, with all of the new benefits of G7 for accuracy, comfort, and ease of use, most patients should be switched from G6 to G7, but that's also considering patient preference and coverage, of course. Okay, we'll spend the next couple of slides going over the apps that patients use with the system. Now, I want to be clear in this section that there's a couple of apps here, and I want to, sometimes there can be a little bit of confusion here. There are these three apps. Now, Dexcom G7 app and Clarity are for patients. Dexcom G7 app is a mandatory app. So patients, if they're using their smartphone, they have to download the G7 app to be able to get the readings. They can also download Dexcom Clarity if they want more of those reports that we'll get into later and more information to be able to send to their healthcare providers. But number one, first and foremost, they need to get the G7 app. Now, the Dexcom Follow app is not for patients. It's for caregivers and for family members who want to also have the readings sent over to their phone so they can track whoever's wearing the G7. And we'll go into all three of these app views right now. So with the G7 app, again, this is the mandatory app for patients using phones. This is the home screen. And here you can see the current sensor reading. You can see the trend arrow, which shows where the reading will go in the next 30 minutes. You also see the readings here over an adjustable amount of time. So you can toggle the time period you want to see, and it'll show you the history of readings. If you scroll down on this homepage, you'll also see a Clarity card, which provides some glucose metrics, including time and range. Some of the editable things on this homepage are here. If patients want to add an event, they can click the plus button here to add food or insulin or a note. And they can also use this page to edit the alerts and the high and low thresholds that they would like to set. Now, the next app is Dexcom Clarity. Again, this isn't mandatory, but it's highly recommended to be able to get the most out of the Dexcom system. And patients, when they're on this G7 app and you see the Clarity card here, if they click here, it will bring them into this app, which has a summary of all of the different insights, lots of different reports here, which we'll get into later on in the presentation, that both patients and healthcare providers and pharmacists can really get a lot out of. And users can, using this app, download and share these reports with their pharmacists or other primary care providers. And the last app is the Follow app, which this is more so helpful for patients who are children or older adults who are using the G7 system, and there's a caregiver or a parent that wants to monitor them. We have a slide here on the G7 receiver. So if patients are using a receiver, they won't be able to directly share with family members or with their healthcare provider. They'll have to download it and provide it to either the pharmacist or their healthcare provider separately, because it doesn't have that cellular data or internet connectivity. Again, if your patients need to check for compatible smart devices, there's a link that they can see on the Dexcom website. Okay, so let's get into the setup, which again, it's very easy now. When we help patients get started, number one, as mentioned, if they're using smartphones, they need to download the G7 app, and it really goes through step by step for them on the application process. If they need any additional support, Dexcom has a team of CDEs available that are available to help with getting started, any sensor insertion questions or tips, help using the G7 system, and they can be reached at this phone number. And this is an example of what patients will see on the app view when they start going through the process. Again, it's very visual, very easy, step by step. If you need to, there's also a video here that you can pull up for patients who maybe aren't using the app, that's linked on this slide. Okay, for insertion sites, there's a bit of flexibility for Dexcom. For most patients ages 2 and up, you'll want to insert in the back of the upper arm. And, at this site behind the upper arm, that's where a lot of that accuracy data is from, right? So ideally in the back of the upper arm. If that's not an option or they don't want to, then the abdomen is fine as well, although that's not indicated for pregnant women. So back of the upper arm or abdomen for most individuals. For children, especially ones who have low body fat percentage, you may want to try the upper buttocks, which is also an indicated site. Okay, so once you go through setup, the patient will have a chance to customize alarms, and you can either support the patient in doing it or give them a heads up in terms of what some of these alarms may look like. And Dexcom here has a really unique predictive alarm that can tell when a reading is going to get into that urgent range. So under 3.1 millimoles per liter within the next 20 minutes. This alarm is really helpful to get in front of that urgent hypoglycemia. It reduces the cases of hypoglycemia, and it also helps with rebound hyperglycemia, right? So when patients can, if you get in front of it, there's less of a need to take too much carbohydrates, which causes high and rebound high glucose. Some of the other alarms are summarized here, and this is what it may look like on their phones. There's the urgent low and low alerts, which will be red on their phone, and the high glucose alert, which will be yellow. These levels are preset in the app, but you can also customize them based on the patient's goals. And if there's a need to customize alarm, they can do so on this page. And you can see at the top of this page here, there's a new feature where you can silence or make the alarms vibrate, which can be helpful for a certain period. You can't silence them forever. It's only for 6 hours. And on here as well, you can toggle, the patient can toggle the highs and low targets. Okay, so we wanted to add a slide here discussing a new feature with G7, which is the delay first alert. I was at a session a few months ago, and there were endocrinologists there that were really excited for this feature, which allows patients to delay the high alert until a set amount of time has passed. So you can set it for between 15 minutes to 4 hours. So if a set amount of time has passed, where they're in their over their target range, that's when this alert will pop up. So for example, if the upper range is 10 for most patients, the high glucose alarm in the past would trigger right away. Whereas now, if they set it to go off when they've been hyperglycemic for an hour, for example, then it'll wait until they've been over 10 for an hour before setting off that alarm. This is specifically useful for patients who, for example, use insulin or who usually might experience postprandial glucose spikes. Having this on allows them time for their insulin to kick in so that they don't get unnecessary alarms or overcorrect and cause hypoglycemia. Okay. So if there's no questions on getting started with G7, we'll get into some of the reports you can take a look at with clarity.
So Molly, just before you do that, we can answer the question that came through earlier about cardiac issues. So Harley's been kind enough to put the contraindications into the Q&A. So Harley's from Dexcom, and the G7 contraindications are for patients who are undergoing an MRI, diathermy treatment. It's not recommended for patients on dialysis or who are critically ill. And probably the critically ill part would be like hypovolemia. It's not really going to give you accurate measures anymore at that point. So all of that makes a lot of sense.
Okay, we'll get into the clarity card now. So as mentioned before, on the G7 app, there is that the clarity card, which you can see, and this is on the mandatory app that patients have. They can choose the amount of days that they want to look at, and it gives us a really good summary of their glucose control. We see their average glucose. We see their GMI, which is their glucose management indicator, which is an approximation of their A1C. And we also see their time and range. So these two are very helpful with time and range. As mentioned before, 70% time and range is associated with an A1C of about 7. So we want at least 70% of that time to be green in range here, and less than 4% in the low or very low areas. Now, if patients want more information, or if you're doing the consult with patients and you want to dig deeper into it, you can go into Dexcom Clarity, and it provides a little bit more granular data compared to that Clarity card. There's the average glucose like before. There's also standard deviation, which is also known as glycemic variability. We want to reduce the amount of glycemic variability, so a lower number is better. There's GMI, which we mentioned before, is an approximation of A1C. There's patterns on here as well, which it'll list consistent highs or lows over multiple days. And there's also time and range. In addition to these values here, if you go into, there's a menu of options at the bottom of the Clarity app. If you go into the second option here on reports, there's lots of different reports that you can select. I'll run through a few of them, but I just want to emphasize to not get overwhelmed. It's, realistically, it's not feasible to check all of these reports for all of your patients, but the data is there, right? So that's what we want to focus on. The data is really there for patients and for healthcare providers and pharmacies to check if needed. particularly if you have a patient who's not meeting their A1C targets, or you see there's a lot of trending of hypoglycemia, then you may want to pull up some of these reports. So the first one that we'll go over is the patterns report. It provides a daily microview of patient control. If the patient puts in any events on the G7 app, like food or insulin, it'll also show up on this report. So it can help identify, if we see really consistent hypoglycemia, if they're using their events there, maybe there's a reason for that, right? The next one is the trends report, which is really helpful to identify common times when they're out of range. So you can see on the bar here, they're commonly in hyperglycemia, and it'll show up as yellow and orange. There's also the overlay report and daily report. You may not need all of these reports, but if you wanted to see the past 7 days overlaid or the daily report in the selected time period, it's also available. There's a compare report here. So this can be helpful if you are doing diabetes assessments with your patients and there's a change in therapy and you wanted to see comparatively what their glucose control was before the change versus the glucose control after. So you can choose 2 different date ranges and compare the values there. There's also a statistics report here that provides time and range, so per hour or daily. The last one that I want to focus on is the AGP report. So this is the ambulatory glucose profile. This is really helpful because it's a good summary, and I would actually go from that initial clarity card on that G7 app where we see, let me go back to it. If going over something with the patient, I would go look at the clarity card. I would then, if we had time to look at some of these other reports, I would look at the ambulatory glucose report here to look at glycemic variability in this table to see, is it really wide? If it's really wide in the blue area here, then we know that there's a lot of glycemic variability. In that the daily trends, it's not stable. And so there's a higher, whenever it's wider like that, there's a higher chance of hypoglycemia. After looking at this report, I may want to look at this one here, the trends report, to identify trends with hyper and hypoglycemia that we can address either with therapy changes or lifestyle. So
Emily, there's a question here about clarity from Siva, and it's whether this is available to us in Canada and whether the data comes to us unprompted, presumably once the patient's registered with us as their provider.
Yeah, so great questions. What I'm showing you right now is an app view of what the reports that patients can get right on their smartphone, right? So when James and I, for example, were trying G6 and G7, we could open the G7 app and then open the Clarity app and see all of these reports for our readings ourselves. If you wanted to set up Clarity for your clinic, you can do so, and that's something that we can do in Canada. And at the end of the presentation, once we've gone through all the questions, for whoever's interested, I can pull up Dexcom Clarity in the demo clinic that I created with some of our data, and you can see how easy it is to get that data. It was really easy to set up as a healthcare provider, and when it would automatically push these readings from your patients into the Clarity dashboard that you have. So all you need to do is send an email to the patient with your invite code. They just need to paste it on their side, and that data comes through automatically, which I really recommend, especially if you're focusing on diabetes within your practice. It's really easy to remotely monitor all of your patients in one place. Question? The last thing that I wanted to say here is, again, for patients, what I recommend is, number one, for each patient, looking at their time and range, which they can see from their G7 app. Right on their phone, they can show it to you every time you talk to them. Their estimated A1C, which is on there too, and then identify if there's any patterns of hypoglycemia and glycemic variability using the AGP report and some of the trends patterns. And this slide is just a summary of our approach when we try to empower patients with diabetes. We always want to start with collaborative goal setting, identifying what we want to do. Is it bringing down their A1C? Is it reducing their hypoglycemic events? And then using the power of CGM with Dexcom, using the Clarity card and the extra reports if needed to identify key information like the time and range, like hypoglycemia trends. And when we look at these numbers, we want to look at patterns and we want to discuss with patients collaboratively. Is there a behavioral reason for their trends? For example, if we're constantly seeing on the trends report hypoglycemia every morning, is it because they're going to the gym, or is it because they're skipping breakfast, or is it because of their insulin therapy, right? So after addressing all of that with them, then you can make your recommendations. And the great thing with having the Clarity reports, especially if you have it on the professional side, is that you can share the reports with your prescribers as well with your recommendation. And ultimately, all these steps, it's an iterative process, but with CGM tools that patients are now able to access, it makes patients more empowered to self-manage with all of that new data that they can see. Okay. So we'll go over a couple of things, considerations for the pharmacy side. Ideally, we want to identify patients who may benefit. So again, the Diabetes Canada Targets identifies patients who have type 1 diabetes or type 2 diabetes and are on insulin therapy, experience hypoglycemia or hypoglycemia unawareness, or aren't able to reach their A1C levels. That's someone that you might want to discuss CGM with and see if even a trial really would give patients a lot of context to help them self-manage. Then you want to schedule medication reviews with users. And if you are going to have this be a focus in your practice in diabetes, then I would definitely recommend registering for a Dexcom Clarity account to be able to connect with patients in an easier way. For questions that we sometimes get about sensor troubleshooting or replacements, Dexcom has a sensor replacement program. So patients can call this number or go to the contact page. They will get a replacement voucher, which has billing information for the pharmacy to bill a new replacement sensor for them. From what I hear, it's a really simple process. And as mentioned before, there's a Dexcom care team with CDEs that are able to provide clinical support for patients and also to pharmacy team members if you need support in starting or, supporting a patient using G7. Okay. So I know there were some questions on coverage, and we'll probably continue to have questions on coverage. Public coverage, because G7 came out again in October 2023, right? So it's only been a few months. It's still a relatively new product. And so public coverage for it is constantly being updated. We have a summary table here, but it doesn't provide all of the details. Contextually, each province deals with it a little bit differently. And there might be slightly different eligibility criteria, even for the provinces that have a check mark. The ones that don't have a check mark, I think I saw a question in the Q&A on Ontario. So in Ontario, only G6 is covered, and it's not covered through the ODB program. It's covered through ADP, which a lot of the times pharmacies don't get so much exposure into. But, these things are always changing, and with the changing landscape of CGM, expect updates. And you can see the latest data on the Dexcom website. A good thing is that both G6 and G7 are covered by the NIHB program if patients are on insulin. So they are able to get G6 and G7 with prescription through NIHB at the pharmacy, but they do need approval before you can bill it. So there's details on this slide here for coverage requests. In terms of private coverage, there's pretty good private coverage for Dexcom for patients who are type 1 or type 2 diabetes, especially if they're on insulin. There's more information here, and Dexcom has a team of account specialists. If you wanted to check specific plans for coverage, feel free to use their resources here. Certain insurers will treat Dexcom a little bit differently. We have some insurers that will allow pay direct and some insurers which will require pay and submit. So pay direct insurers include Green Shield and Manulife for G7, and pay and submit insurers include Sun Life and Canada Life. That being said, every individual plan and the employers that work with these insurers might choose different things as a part of the plan. So this isn't a blanket rule that everybody in Green Shield can pay direct, for example. So there's still a little bit of nuance between plans. The full list with some more details are on Dexcom's website, but it's likely that you'll have to support the patient. They'll have to try and see the details of their plan, or you can try to work with Dexcom's account specialists as well. For patients where cost is a consideration, Dexcom also offers a patient benefit program. And so the program, you can head to this link here and download a copay card. The card will cover up to 20% of the cost of G7 sensors. They must have a prescription to be able to bill this, and it is direct billing. Okay, so we made really good time. I'm on the last.
Maybe before you dive into the resources,
Sure.
there's a couple interesting questions. So one is, can you just repeat about the replacement sensors?
Yeah. So we'll go back here. So Dexcom has really good support with sensor replacement. So let's say a patient has issues with a sensor issue in terms of, technical issue, or it's coming off, or anything like that. Feel free to contact this number on the slide here, and the replacement team will be able to send a voucher from, so it's billed through NextGen RX, which is how you bill it in the pharmacy, but it goes to the patient through email, so they can bring that voucher back to the pharmacy so that you can bill that replacement.
That sounds like a great program. Jess, did you want to ask the next question?
Yeah, so we have one more question. Does a Dexcom educator helpline help with coverage navigation? So yes, Dexcom's team of account specialists can help patients check with their coverage. So you can either call them, or there's also a website that you can navigate patients towards. And then also in our infographic, there's a QR code that allows for easy access to that.
Thanks.
Awesome. There's another question here, Molly, about comparing accuracy between the Libre 2 and the G7.
Okay, good question there. So the G7 is the most accurate sensor that's available in Canada. So to answer that question simply, yes, it is most accurate. A question that may pop up is, what do patients choose? And obviously there's no one answer fits all for patients. And you want to consider multiple different factors such as ease of use and budget and coverage. But if we're looking on the accuracy side, then G7 is superior in accuracy.
So that's it for questions for now, Molly, if you want to get into the resources.
Okay, I only have a couple more slides. So if there's any other questions, I'm free to stay behind after the session as well to go over questions, and then after we'll go into the Dexcom Clarity account for providers. So in addition to this webinar, we've built both an infographic for pharmacists to better understand the Dexcom system, plus counseling guides for both pharmacy team members and pharmacists on how to identify patients, how to answer commonly asked questions, and conversation starters about CGM as well. So we'll be sending those out. Please complete the survey James and Jess, are you able to access the chat? If not, I can put the survey in.
No, Molly, can you put it in?
Okay, yeah, I'll put it in right after. And the last slide that I really have here is about our Dexcom resources. So in addition to the resources that we created at Whole Health for pharmacy teams, Dexcom also created a bunch of resources, training videos. There's wholesaler numbers, billing information, all on this website also. That brings us to the end of our presentation. So let me put
So Molly, while you're doing that, there's a question about, is there like a free trial program for patients?
That's a good question. To my knowledge, there isn't a program similar to what was provided previously for Libre, but there is that copay system to give patients a little bit of coverage of the G7 system. If you have a rep that you work with too from Dexcom, it might be worth talking to them. I always say that, like, as pharmacists, it's really helpful for us to try these systems to be able to know what we're talking about, right? When we talk to patients, and like be able to know what sort of data we can glean from these systems.
Well, not just for ourselves, but like, how do you teach a patient how to use it?
Yeah.
So for me, it was really enlightening and a really positive experience with the G7. I actually really enjoyed, having your meal and then watching what happens on your own chart and learning about how to interpret that. And like you showed earlier, like the pointed circles that kind of indicate how fast your sugar is changing. So if it's going like straight up, like, or straight down, your sugar is changing very fast. So even learning some of the really intuitive features that are available in the app was really, really fun.
Mhm.
So we really would like it if folks would click that link and complete the feedback survey. It helps us planning future presentations. So please do that. We really value your feedback. And Molly, I think you're going to take us through your own readings.
Yes. Okay.
Very brave.
Nobody judge me for my readings, please. James and I have an inside joke that I actually have diabetes from some of these readings. Okay.
We'll see what the group says.
Okay, so once you, oops.
Should put up a poll, yes or no.
Okay, so once you, if you want to get set up with Dexcom Clarity, I can send additional details when we send the recording out later. But it was a really simple process. You really just sign up with your email, and you're able to access this and have a code that you're able to share with patients. We're looking at the dashboard right now. So if you had multiple patients, they would show up as lines here of patients that are part of your clinic using the G7 system, and you can search for patients here as well. So I'll click on myself here. I can either upload data. So if I was using a receiver, not using my smartphone, for example, this would be helpful. Save or print reports, for example, if you wanted to print it for the patient to go over during a medication review, or if you want to print it for prescribers to review with your recommendations, or if you wanted to look at their reports right away, we can go into interactive reports. And you'll see just how simple it is to have all of this data at your fingertips in this dynamic dashboard. Now, because I didn't use the system for an extended period of time, I only used it within that 10-day period. So I don't have enough data for some of these measures like estimated A1C, but you see my average glucose, you see my time in range, which at this level looks pretty good. So James, I don't know about the diabetes there, but you see the time in range. So remember, as I said before, always looking at the time in range, looking at the glycemic variability. So you want this to be low, looking at their estimated A1C. You also want to look at their sensor usage as well. So making sure that they're actually wearing their sensor for an extended amount of time. There's no gaps so that it actually provides the full picture. And then on the left side, it has a list of reports that you can pull up for the patient. And as we discussed, AGP is really helpful. It goes a little bit more deeper into the time and range report here, into the estimated A1C, into variability. And you see this river table here, which shows you the times when it's common to see glycemic variability, especially in the evening here, as I was eating dinner at various different times. And a lot of, for me, a lot of hypoglycemia in the morning. So you can clearly see on these tables where your patients are having that hypoglycemia or that hyperglycemia. And then
it really takes away all the fun. I used to have charting out logbooks, Molly.
Isn't technology
Wonderful.
amazing?
It's so wonderful. Yeah.
And for the AGP report as well, you can also take a look at the daily report. And if you scroll over, you can take a look at all of the readings. And these are all the different ones that we went over. I personally like the trend one because it gives a really easy way to see the hyper and hypoglycemia, again, which is our focus a lot of the time with diabetes, trying to reduce the hypos. But, you know, all of these other reports can be helpful as well. And this is the compare report, which I covered. I don't have enough data to really compare, but if you had a patient with enough G7 data, you could pull up two periods of time to compare, you know, treatment change and post-treatment change to see if there was a difference in their glucose control.
And then Molly, we have a question in the chat about coverage through ADP for type 1 diabetes. So right now, Dexcom G7 isn't covered or listed, but the Dexcom G6 is covered under ADP.
Only the G6 right now in Ontario, yeah. The ADP. All right. That brings us to the end of our presentation. If anybody has any other questions, we're happy to stay on and answer them. But otherwise, thanks everyone so much for your attendance and participation here this evening. We'll be sending out the recording and the slides and some of the other resources that we discussed. If you haven't already, please fill out our survey to be able to give feedback to us. It really helps us in developing future content to make sure that it's helpful to you and content that you want to see. Thanks so much.